Okay, well, I think we'll get started. I'm not sure. There may be a few people that wander in. I know the traffic was particularly bad tonight, but I'm glad to see so many people have returned. So, this is the second night of our concussion education and support workshop, and it's going to be a similar format to last week. So, I'm going to be presenting along with Dr. Tarazi, and we'll be going back and forth. And once again, we're just going to ask people to hold their questions. And if you do have a question, you'll see the yellow sheets that you've got, so you can just write down the questions. We'll collect those at the end. And then Dr. Tatter is once again here and will be available to answer your questions. Last week, we reviewed concussion and the diagnosis and did a bit of an introduction in terms of treatment and that kind of thing. But tonight our goal is really to try and provide you with some tools, some additional tools. We introduced a couple of those last week, cognitive behavioral therapy and mindfulness meditation. So we'll touch on those again tonight and hopefully be able to provide you with something that you may be able to try when you leave here. Sorry, and I'm on the wrong night. My apologies. Okay. So tonight we're going to talk about really more coping with concussion, symptom management, strategies and tools, talking a little bit about the difficulty in dealing with persistent symptoms and the uncertainty that goes with that, a little bit about future innovations, and then we're going to have our question and answer period. So as you'll recall from last week, symptoms following concussion can span really, all domains: physical, cognitive, emotional, and behavioral. And there are some symptoms that are particularly common. So headaches, sleep difficulties, fatigue, and mood seem to be some of the most prominent and are particularly important to address because these symptoms in and of themselves can lead to worsening and causing other types of symptoms. So it's also important to keep in mind that the tools that we're suggesting are not specific to the symptoms that you're experiencing and may, as we talked about last week, be helpful for a variety of symptoms. And I'm going to turn it over to Dr. Tarazi now to talk about headache.
Hello, everybody. We know that headache is one of the most commonest symptoms after concussion as a part of the post-concussion syndrome. We have different types of headaches, tension type, migraine type headaches, and even those headaches which are related to the neck injury. So it's very important the history that we take from the patient. Yes.
We're having a bit of trouble hearing that. Sorry, if you can speak up.
Okay. It's very important. The history of the headache is very important. The frequency of the headache, how many days a week or a month a patient has headaches, and the localization of the headache. It is localized to which part of the head, back of the head, to the temporals, or behind the eyes, and also the nature. What is the nature? Different complaints, for example, pressure type, stabbing, sharp pain, dull pain, throbbing, and pounding. So these characteristics can help us to define the type of the headache. Some injuries, especially acceleration, deceleration injuries, and which cause whiplash, they can cause some cervical spine problems and injury, which can lead to headaches. And it's usually because of the overlapping of some pain receptors. That, for example, the pain of the neck, we can feel it in the frontotemporal region or behind the eyes. The point which is very important in managing headaches is that we shouldn't use painkillers. too many painkillers, because the painkillers such as Tylenol, Advil, they can cause rebound headaches, which this rebound headache usually is very resistant to treatment. Sometimes we cannot distinguish that this headache is as a part of a post-concussion syndrome or it's a rebound headache due to overusage of the Tylenol or Advil. But it's very important to treat these headaches. And if the pain persists, we highly recommend to patients to be referred to a headache specialist, which is usually a neurologist, in order to get treatment, because actually the headaches can affect the quality of life, like other symptoms of the post-concussion syndrome. So it's very important to be treated. Sleep problems. 50% of patients with concussion, they suffer from some sleep problems, including problem getting to sleep or staying asleep, and even sleep apnea. They may be drowsy during the day. They may take many naps during the day. In the acute phase of the concussion, taking naps, it's a part of a recovery. So it's usually we should rest our brain. For example, when you need to sleep, you should sleep. But napping in the chronic phase, they can cause some problems in the overnight sleep because it means that you cannot have a good sleep at night, that you are drowsy during the day. Maybe the patients have sleep apnea, or maybe when the patient has many ups at night, it means that that patient has some sleep problems, so he or she has to take naps during the day and is drowsy. So daytime somnolence is not something normal. Sleep is a part of a healthy lifestyle, so sleep problems should be treated. When someone has sleep problems after the concussion, it can affect the cognition. So it's very important. That's the reason which is very important to be treated. Sometimes when there is sleep apnea, the patient wakes up with headaches. This headache is due to that sleep apnea. So it's very important to treat headaches, and this treatment can affect the mental capacities, and also can affect mood issues, and also can higher the quality of life of the patient. So there are different types of treatments for headaches. The non-medication types, including CBT, doing physical activity, and sleep hygiene, a very good sleep hygiene. For example, before going to bed, it's very important not to use cell phones or a computer screen or watching TV. So just being prepared for getting to sleep, and also treating the mood issues, decreasing the stress level. All these things are the non-medication treatments for sleep problems. But the medications, they are categorized. We have different kinds of medications for treating sleep problems. Unfortunately, they are not a good. They are not a good treatment. They can be used only for a short period of time because they can cause dependency, they can affect cognition. Sometimes, for example, for the headaches, we use some migraine type headaches, we use tricyclics, and that tricyclic can help also with the sleep. So we recommend the patient to use it at night in order to help with the headaches and with the sleep. Or sometimes treating some mood issues with antidepressant, they can also help with the sleep. So at the same time, we can treat the mood issues and the sleep. But the problem with benzodiazepines, which are the sleeping pills, is that they can cause dependency, and after a short period of time you have to increase the dosage in order to have the same quality of sleep. so usually are not recommended for a long period of time. Melatonin can be useful when someone has the complaint of the problem getting to sleep. But for those with many ups at night and trouble staying asleep, melatonin has no use. And also some supplements can help sometimes with the sleep, such as magnesium and zinc. Fatigue also is one of the most common symptoms of concussion, and also it can affect negatively the quality of life. So it's very important not to push ourselves after the concussion, and to take many breaks, and also not to be overwhelmed by too much mental and physical activities. Fatigue can be in a vicious cycles with other symptoms, with headaches, with sleep problems, with mood issues. So it's one of the most common and most important symptoms after the concussion. Vestibular and visual difficulties. These are also very common after concussions, depending it's individual based. Different complaints, for example, vertigo, dizziness, lightheadedness with, for example, position change, with sudden head turning. Sometimes patients experience these symptoms: unsteadiness, vertigo, dizziness, and balance issues, and also visual problems. For example, they have problem reading even from the papers, or they cannot tolerate computer screen. They cannot accommodate for near distance. The convergence is impaired. So these are the symptoms. They cannot follow the moving objects. So these are the symptoms which are common and as a part of the visual problems after the concussion. And we know that the ocular system and vestibular system and somatosensory system, they are all together. They should working together perfectly in order to give a good function to a person to be in a complex visual spatial environment. So if one of these systems does not work properly, which is very common after concussion, they can cause these symptoms. So you feel dizzy, you feel something spinning around you. So it's very important to diagnose them. Vestibular assessment is a part of the diagnosis. It's important to know that this vertigo, this dizziness, imbalance, or unsteadiness is due to some vestibular dysfunction, or is it due to something central. When it's due to vestibular dysfunction, for example, inner ear involvement, or benign positional vertigo, or some problems with even a trauma to labyrinthine trauma, they can cause vertigo, a true vertigo with positional, which is very positional. And if we diagnose that this is a vestibular dysfunction, there is some treatment for that, which is a vestibular rehabilitation. Usually vestibular rehabilitation does not work for those balance issues which has a source in the central nervous system. They are usually effective with problems in the middle ear or inner ear. There are some psychiatric symptoms, and these include mainly in the acute phase, they include irritability, to be impulsive, anxiety, and some swings in the mood with depression and loss of motivation and apathy. But depression and anxiety can be a complication of the can be a part of a post-concussion syndrome in long term. But the point which is important is that while we take history, it's important to know that if the patient has a history of mood issues before concussion or not. Sometimes it gets worsened after the concussion. And most of the time also, these mood issues, these psychiatric problems, depression, anxiety, is a part of a post-concussion syndrome. It's from what happened in the brain that the patients have mood issues, but it requires prompt treatment because mood issues can delay and can slow down the recovery phase. So it's very important to treat it and to deal with it. And also the mood issues can affect other symptoms. For example, someone with depression or anxiety can have intractable headaches or some issues with the sleep. So as I told you before, they are in a cycle. But it's important to rule out some diseases such as anemia, B12 deficiency, thyroid disease, some hormonal changes. So it's very important to be sure that there is we ruled out other diseases, and now these are mood issues, which are a main concern, and we should treat them. And there are two types of treatments for mood issues, including drug treatment and non-medication, exactly like sleep. One of the medication which is very common with less side effects are the SSRIs. They are used currently. They are used. They are very popular and they are used with less side effects, and they can treat depression. So it's very important to seek treatment for these mood issues, even if we have to take medication. But first, usually we try to use non-drug treatments, including psychotherapy, especially CBT, and some meditation, or to have a healthy lifestyle, sleep hygiene, and also to do some aerobic exercise, physical activity, including methods including relaxation. They can all help us with the mood issues, but sometimes it's really needed to start a new medication. So the patient should not be very resistant to seek help from a psychotherapist, including a psychologist or a psychiatrist. And it's very important to tell the family physician, your family physician, about the mood issues that you have in order to be referred to a proper person.
So just in terms of mental health issues and treatment, we spoke a little bit about cognitive behavioral therapy last week. I'm just curious, did anyone try, there was a thought record in your handouts, was anyone able to try that out, or has anybody used them in the past? No? Okay. So cognitive behavioral therapy, just a bit of a recap, it's a very well-researched method of psychotherapy that was initially developed in the treatment of depression, but has since been shown to be effective for many different types of issues. And basically the idea is that you're encouraging people to look at their thinking and the way that they're thinking about things. And the idea being that, the way that we respond, the way that we think about a situation can very much impact on our mood and our behavior. And that in turn can feed back on what we're thinking. So in terms of, just as an example, in terms of linking thoughts and moods, and we talked about the thought record, this is a bit more simplistic example, but basically you've got an event or a situation that occurs. So in this situation, the individual is out with friends in a noisy restaurant. They're having difficulty following the conversation, having to ask others to repeat themselves. The belief or the thought is, I will never be able to live a normal life. And then the consequence is then the emotion or the feeling. So this feeling of being scared, of being sad, of being frustrated, my symptoms are not improving. And just on that note, it's kind of helpful to link this back. We spoke about neuroplasticity last week, and neuroplasticity is really, it's about how the brain is able to learn and change as a result of our experiences, as a result of our behavior. And we often think about it in positive terms, in that, if you do good things in terms of learning, and you can actually cause positive change in the brain. But the other thing to remember is that the brain doesn't really distinguish between good and bad in terms of what's happening. So anything, whether it's thoughts, whether it's behaviors, when they're repeated, the brain is learning those things. So if someone is constantly, telling themselves negative things, that is laying down a path in the brain that will continue to be activated. So, when you think about it, these tools are, sort of working on in another aspect of neuroplasticity in terms of trying to get at your thinking. I mean, I think we all do this. This gives you some examples. In cognitive behavioral therapy, they talk about thinking errors. So it's, these are, examples would be all or none thinking. So seeing things very much in black and white, not being able to see anything in between. So if you don't, do as well as you expected on something, then you're a complete failure. Overgeneralization, seeing a single negative event as, everything is negative, and this is never going to, stop. Further on the thinking error issues, in cognitive behavioral therapy, we often encourage people to, again, looking at your thinking, and people often have things like I should, I shouldn't, I must, and again, this sort of puts you into that black or white kind of thinking pattern. And the emotional consequences that can follow from that are things like feeling guilty, feeling angry, frustrated. So just as an example in terms of your symptoms, I shouldn't be tired all of the time. I should always be feeling good. I should never get headaches. And I think this is important to remember as well, especially with post-concussive symptoms, because they're really not very specific. So there are lots of reasons, why someone can be depressed, why someone could have a headache. So it's important to not necessarily attribute everything back to the concussion. So in terms of the thought record, so this is what you had in your handout last week. And again, when you leave, I would again encourage you, if, you find yourself in a situation where you notice your mood changing, towards the negative side, whether it be feeling irritated or sad or anxious, try and work through one of these. The situation here is, so this individual, it's Monday morning, it's 8 a.m., and they've woken up with a headache. So you're just sort of jotting this down in your thought record. And then what you do is to, identify what your mood is. So in this situation, the person is feeling sad, they're feeling anxious, they're feeling angry, and they're asked to rate the mood on a scale of 1 to 100. So how sad are you feeling? 70% sad. And then the next step is looking at what we call, so this is where you're looking at your thinking, and they call it automatic thoughts. And the idea is to try and identify what those automatic thoughts are at that point that you wake up with a headache. And sometimes it takes a bit of work to do that, because a lot of our thoughts tend to, happen very, very quickly, and sometimes we're not even entirely aware until that sad mood hits that anything is wrong. So in this case, the person is saying, my whole day is ruined. I won't be able to do any of the activities that I'd planned to do. These symptoms will never get better. And then what you would be encouraged to do, and again, this is working through very quickly, but this is sort of the idea if you were working with a therapist. The idea then is to actually identify the one thought that they will call the hot thought. And the hot thought is really that particular thought that's really driving the negative emotion. So in this case, they're circling these symptoms will never get better. From there, you go on to work on trying to come up with a more balanced or alternative thought. So you look at evidence that might support the fact that my symptoms will never get better, as well as evidence that would go against that and that might challenge that. So in this case, they're saying this is the third time this week that I've woken up with a headache. Sometimes the headaches get so bad that I have to stay home. On the flip side, my headaches are not as severe as they used to be, and I now have occasional pain-free days. And I think this is a really important point too in terms of tracking your symptoms. So we often encourage people to keep track of whether it's headaches or your sleep or your exercise, so that you actually can kind of look back, because it's easy to forget, especially when, you know, your symptoms may be up and down, to maybe see that there is, you know, some improvement over time. So keeping track of those things can be helpful. And then the idea is to try and come up with, hopefully, a more balanced or alternative thought that's going to help you feel better. And it's not like you're just necessarily trying to spin it. Hopefully that this will be moving you in the right direction, perhaps to be feeling a little less sad, a bit more hopeful, perhaps a little less anxious. So in this case, I still get headaches, but they're not as frequent and severe as they once were. I still experience symptoms of concussion, but they're slowly improving. And then you're actually asked to rate how much you believe that statement, because it may be the case you put the statement down and you don't believe it. So you want to try and come up with something that's going to be somewhat more balanced and believable. And then finally, you're asked to re-rate your mood. So ideally, you know, you're, in terms of the negative emotions, those things are coming down. Okay. So that was the mental health issues. One of the other things that we hear from people are that they're having difficulties with their cognition or with their thinking abilities. Very often people are reporting difficulties with their attention, with their concentration, with how quickly they're able to process information, different aspects of executive functioning, that is planning, organizing, problem solving, and certainly memory too. In terms of recovery time, it's generally expected that, you know, people after a concussion will improve within a week, anywhere from a week to 6 months, in terms of what the research tells us. But again, there are definitely people, you know, this smaller proportion that may go on to have more persistent and longer lasting cognitive issues. But the important thing, the difficult thing here is that it's not always clear what it is that's causing the cognitive issues. It can be the concussion and the injury that has been sustained as a result of that. But it's also important to take into consideration things like how much you're sleeping. So if you're not sleeping very well, chances are you're not going to be able to concentrate and remember things as well as you would have. If you're dealing with headache pain or other types of pain, that can also impact on thinking abilities. Medication. So it's a complicated picture, and so it's important that if you are having more persistent symptoms, that you have an evaluation for that. In terms of what you can do for cognitive difficulties, certainly one of the first things is just, you know, being educated in terms of what the symptoms may be and looking into those causes to try and decipher what might be contributing. Also, coping strategies, as we've talked about, again, with mindfulness meditation, with cognitive behavioral therapy, all of those things can be helpful in terms of, certainly with the mindfulness meditation, even directly, they've done studies looking at individuals that are engaging in this on a regular basis and seeing that they have improved attention, focus, concentration. There are also strategies, so, you know, working with, potentially an occupational therapist, or just, you know, depending on the severity, doing it on your own in terms of just, you know, using memory strategies. So for example, if you're having difficulties remembering things, you may need to write things down more, make lists, set alarms, that kind of thing. And for people that, again, who have more persistent symptoms, neuropsychological testing can be helpful in terms of trying to tease out what is going on. In terms of, again, what you can do to help with cognition, we know that cognitive stimulation is really important. So in terms of challenging your brain, stimulating your brain, is going to help to with that positive sort of neuroplasticity that we talked about last week. So challenging yourself, learning new things, learning a musical instrument, a language, and, you know, anything like that is incredibly good for our brains. There are online games that some people may play. Again, we don't have any definitive research to suggest that this is necessarily going to make any significant changes in terms of your cognition. There has been some recent research suggesting that some of the ones focusing on speed of processing may be helpful and may be more generalizable as opposed to just getting you better at a particular game. But certainly anything that you enjoy and that's challenging, that's new, that's different is good for your brain. And certainly just staying mentally and physically. So we talked about physical activity. We'll come back to that. Again, is a really good thing to do for your brain, and certainly socializing, and because that can be something that happens as well with the mental health issues. When people get depressed, they may tend to withdraw from other people, socialize less, and then that can snowball into other difficulties as well. So we introduced mindfulness meditation last week, and again, I think can, in terms of one of these tools that could be helpful for a variety of symptoms, is something that we would really encourage you to try. Research has demonstrated neuroplasticity or changes in the brain in people that are doing this regularly, and there have been positive effects on mental fatigue, which is something that we hear from people often, that they're just much more easily tired and fatigued, and also improvement on tests of speed of processing and attention. So we thought we'd do one more. We're just going to do another short mindfulness breathing exercise. I'm wondering if we can shut some of the lights down.
Mindfulness of breath. 3-minute breathing exercise. To prepare for this exercise, just take a few moments, whether you're sitting or standing, just to find a comfortable position. You may choose to close your eyes or keep them open. If you're feeling a bit tired, it may be useful to let just a little bit of light in to keep you alert. Begin by gently moving your attention onto the process of breathing, simply observing each breath as it happens, whether you focus on the rise and fall of your chest or abdomen, or perhaps the sensation of the breath as it moves in and out of the nostrils. Are the breaths deep or shallow, long or short? Really feel what it is like to breathe, without feeling the need to alter your breath, just observing it as it happens. As you engage with this exercise, you may find that your mind wanders, caught by thoughts or by noises around the room or bodily sensations. When you notice that this happens, know that this is okay and that our mind often wanders. Simply notice what has caught your mind's attention, then gently bring your focus back to the breath. You may find as you watch your breath that it begins to change or stays at a steady pace. Whatever your breath is doing, just watch it in this moment and feel what it is like to be breathing. Again, if your mind wanders, it may do so many times. As you notice that your focus has moved from breathing, you may wish to simply label the distraction as thinking or as a feeling or as sensations or noise. Then just gently bring your attention back onto the process of breathing. As we move towards the end of this short exercise, I invite you to allow yourself to be really aware of your next few breaths, focusing on every sensation as the breath comes in and as it flows out. Take a few moments to yourself just to feel really connected with the present moment. Now, as you feel comfortable to do so, you can expand your awareness from the breath into the rest of your body and the room around you. And when you feel ready to do so, you can open your eyes and bring the exercise to a close.
Okay, so in terms of the mindfulness meditation, that last one that we just played, it's listed in your resource section. There's a site called Free Mindfulness Resources, and they've got several guided meditations that range just from 3 minutes to up to 45 minutes. So, a good place to start is just trying to set aside 3 minutes a day to do that. Just a few more tools that we wanted to talk about before we move on to the question and answers. One being diet and nutrition, and I think this was referred to, last week. And many of these things, we don't have solid evidence to, suggest that this is going to cure post-concussive symptoms. But certainly, one of the things in terms of nutrition, there is research, looking at these things, and there has been some suggestion that, a lot of it is common sense, but certainly in terms of maintaining a healthy diet, avoiding refined sugars, there are, a number of studies that are looking at omega-3 fatty acids that seem to be good for the brain, and generally a Mediterranean sort of style diet. So anything that's heart healthy is generally brain healthy, and there are a number of, there's books that are available that are listed in your resource section. In terms of alcohol and recreational drugs, again, it's something that you do want to avoid. I think we talked about this last week, but when you're still symptomatic, your brain really it's extra vulnerable to the effects of alcohol and recreational drugs. It also increases the risk, if you do drink, that you can re-injure yourself, if your balance isn't 100%, and can slightly increase the chance of seizures and slow recovery. And then importantly, it can also just make the symptoms that you're already having worse. So for example, if you're not sleeping well, as much as alcohol can make you sleepy, it actually interferes with your sleep. So not ideal. And similarly with mood and thinking issues, can also negatively impact on those. As we've talked about a few times now, physical exercise, again, really important, and probably in terms of the evidence that we have, in terms of something that you can do that would be helpful for symptoms, physical exercise definitely seems to be one of them. One of the things that happens is when we get aerobic exercise and get our heart rates up, there are a number of things that are released in the brain. One of them called BDNF, which is brain-derived neurotropic factor, which actually supports survival and encourages growth and differentiation of new brain cells. We also know that there's endorphins that are released, so it can help us in terms of our mood and how we're feeling, and has also been shown to help with cognition, in terms of keeping our brain sharp, with mood, with stress. And there's also some suggestion as well that if you are inactive, that it can actually worsen symptoms. So certainly low-level exercise, starting off, you don't want to go crazy if you haven't been doing anything. You want to do it gradually. But if you're able to track that and slowly increase that's probably the best way to go. In terms of timing, because that's often a question, is when can I exercise? It's not entirely clear, but they've suggested that 1 month post-concussion is probably a reasonable time to start that. And then, as I mentioned, the University of Buffalo has done a fair bit of research, and you can check out their studies on their site. It's listed there. So I think overall, in terms of one of the biggest things that through running the workshop over the past couple years that we've heard from people, one of the most challenging things is really just this uncertainty and not knowing when the symptoms are going to go away. And unfortunately, no one is able to tell you with any certainty when that will be. And I think right now the best that we're able to do is to work, within those guidelines that we have, and in terms of trying to incorporate some of these strategies that, that may or may not be helpful for you, but hopefully some of them may be, in terms of at least helping you to cope better with the symptoms that you're having, in terms of, keeping your stress at a lower level, tracking and logging your achievements. So as I said, keeping track of how you're doing, of, those little wins that you may have and gains. And then certainly seeking out support is really important. I think that's one of the other biggest thing that we've heard from people that have attended the workshop, is that it's been helpful to know that they're not the only person dealing with this. And so with that, there are things sort of coming on board. As I mentioned at the beginning, the Ontario Brain Injury Association has this online support group. The BIS, the Brain Injury Society of Toronto, has run, I think, 3 in-person support groups to date. So that's another site that you can check out. I'm not sure where they're at right now. They may be, they probably have another one coming up, but you could contact them to find out. So increasingly there are more supports in the community for people that are having more persistent symptoms. So that's something to look at as well. And then certainly moving forward, I mean, it's obvious that there's a lot more research that is required. There have been lots of advances in terms of prevention. Parachute it has a great website, as Dr. Tatter had mentioned last week, with all kinds of resources. And certainly, there's a lot more awareness now, certainly in sports with kids, in terms of return to play guidelines. And then in terms of technology, there are all kinds of research going on looking at, improvements in the diagnosis of a concussion. For example, that at some point down the road there may be a blood test that can make that diagnosis. And then there are different types of equipment in terms of sports that are being looked at. Intelligent mouth guards was something I saw last week, where a player is actually wearing a mouth guard, and through Bluetooth technology they're actually measuring the force and able to then either take them off the field or not, depending on the force of the hit. Color changing helmets was another one that I just saw this week as well. And then of course there's lots of alternative therapies that are always possible. It's just always good to keep in mind that at this point many of these things do not have evidence to back them up. So you just need to keep that in mind.